Okay. I didn't realize it was like 2 minutes too. Sound check. Brian, can you hear me? Awesome, thanks.
Oh, okay. We're a big system. A lot of moving parts. All right. Good morning.
That would be right?
Okay, so Mia's on. Oh,
I wasn't sure. I double checked, yeah.
sorry. Good morning. I'd like to call the meeting of the Managed Care Committee to order, and I'd like to ask the secretary to please call the roll.
Director Harrington,
Present.
Director Webster Cross,
Present.
and Chair Curry.
Present.
Do you have a quorum?
Thank you. Can I have a motion to allow Director Cross to remotely participate in the meeting as a voting member? So moved. Second. Are there any questions on the motion? All in favor? Aye. Aye. All opposed? The ayes have it. The motion carries. The Managed Care Committee's regular meeting schedule for 2025 has not yet been determined. However, it is expected that the committee will begin holding their quarterly meetings starting in January 2025. Madam Secretary, has anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
We didn't receive any registrations nor any written testimony.
Thank you. I'd like to move on to the report on health plan services. Aaron Galena, who is the Chief Administrative Officer of the Health Plan Services, will review the report and metrics. No action or motion is required. This is only presenting information. Mr. Galena?
Thank you, Chair Curry. Starting off today, I will talk through a few of our successes, go through our regular metrics, and then we'll do a deeper dive on a number of our quality measures and strategy. before we go into some strategic updates, and then we'll close out from there. So I wanted to start off with our NCQA health plan rankings. These came out since our last managed care committee meeting, so we received a 4-star status. This puts us in the top 20% of Medicaid health plans nationally, and we're one of only 2 Illinois Medicaid MCOs that received a 4-star rating. We'll certainly talk more about that a bit later as we go through our quality section, but definitely want to express a thank you to our entire team for their work to get to this milestone. Next, you can go one more slide, Deb. County Care was also recognized for 2 Illinois Association of Medicaid Health Plan awards recently, one in the provider partner category for leveraging value-based care to improve member outcomes, and another for partnering with providers for redetermination during what we call the great unwinding of the post-pandemic READY process. We also recently hosted a community baby shower. This was our first community baby shower that we've hosted in an effort to engage more with a number of unengaged members to educate and provide information on prenatal and postpartum care. We had about 20 total members that showed up to our event at Provident, and including family, we had about 40 individuals total. They received a lot of different information, both from our team as well as the Provident team, as well as a number of community-based providers. And so overall, I think a very successful event. We'll be kind of tweaking some of that strategy as we go forward to continue to optimize it. And we're really excited to now track the outcomes of that cohort of individuals to see the impact that has over time. This is some of the pictures from the event, so you can see some of the giveaways, and we had a lot of volunteer staff there. We had opportunities for pictures, and so overall, I think we got really good feedback from the individuals that attended. Next slide shows our team out at the Bud Billiken Parade, which we also attended since the last managed care committee meeting. So always a fun event, and the team is always really excited to get out into the community and have a chance to interact with our members. We were also recognized in the past few months with 2 National Association of County Awards, one for addressing food insecurity, which was recognized as a Best in Health category winner, and also engaging members during redetermination, as well as our project around improving member demographics. All right, switching gears into our health plan metrics. Our membership as of September is at 417,000. As expected, now that we're into October, we've seen membership really stabilize. We had a slight increase in membership from September to October. So we're past this large 12-month wave of redetermination. And so certainly we still have a number of individuals that will go through READY each month, but this large wave of the post-pandemic era, we have finally closed out. So we expect membership to stabilize going forward, and we'll be continuing to pursue a number of different strategies that are more focused around organic growth than some of our previous efforts were over the past 12 to 18 months. One area we're continuing to focus heavily on for the 90-day window is the healthy benefit for immigrant adult members. So these individuals had until the end of August to submit their redetermination information, and we saw about 6,000 members that lost coverage during that period. There's now a 90-day window that these individuals have to fill out their paperwork and get that submitted for them to be reinstated back into the program. So we are doing a heavy outreach strategy to these 6,000 individuals, layering in a lot of community events as well targeted at this population, in hopes to drive some opportunities for those 6,000 individuals to to apply back into the program. This shows the overall market share data in Cook County. County Care is still at the top in the market, 34.2%. This is about a total 1% increase from this point last year, which is pretty significant on a total base of about 1.2 million Medicaid members in the county. This shows that overall trend. So on the right-hand side in red is the overall Medicaid managed care market. You can see it's been shrinking month over month due to that redetermination process that I alluded to previously. On the left-hand side, you can see by comparison County Care's membership, which has generally followed that same trend, but with the exception of the HBIA and HBIS members that we brought on beginning in January of this year through April, which saw some significant increases in our membership. As I mentioned, we're now through this redetermination large wave, and so as we begin, as we get to next quarter and we look back at the data for this quarter, we'll start to see that trend stabilize quite a bit and be more flat month over month. As we're heading towards the end of our budget year, we're continuing to be well in excess of the budget by almost 20% in terms of total membership, driven again by the HBIA, HBIS members, but also driven by our better than expected retention rates for members going through that redetermination process. All right, next up is our quality section, and I am going to turn it over to Emily Lupo, who is our Director of Quality, to talk through this section with you. And I want to take a moment to recognize Emily for all of her work, especially around quality and her work leading to our plan ratings. She's been in this role with us now for a little over a year and has worked with us previously for several years before that, but has done a great job stepping in.
Could I ask you maybe another slide that shows her date of hiring and over those scores there and see how much they correlate so well? I'm glad to hear that, but thank you very much for your hard work. This is fantastic news. Thank you.
It certainly is an all-plan effort, and happy to be here to share some of the highlights today. Aaron spoke to this already, so I won't dwell on this slide, but the next slide has some additional content that we wanted to really highlight for our most recent NCQA health plan ratings. One highlight is really related to member experience. On our CAP survey, County Care was the only plan to achieve a 4-star rating, both in rating of health plan and rating of overall care. That really means our members are having a good experience when they're seeking care in our network, which is really great to see. Another area that County Care really led was in the prevention and equity category. We earned a 3.5-star rating for adolescent immunizations, BMI percentile assessment, which is a key component of well-child visits, and prenatal immunizations. That really speaks to access to maternal and child health services, which is really nice to see. We can go to the next slide. In addition to our NCQA health plan ratings, we also recently received our Health Choice Illinois plan report card from the state of Illinois. County Care is the third row, so if you're looking left to right. The area where we really attained a high rating was women and children's health with a 5-star rating in that category. Area of opportunity for us is related to behavioral health. As you can imagine, it's a really complex population, and we'll share a little bit more momentarily about what we're doing to engage that population. We did achieve 3-star ratings with all of the other categories on that report card, and did see incremental improvement with the measure ratings for those categories as well. This is another way of looking at that HFS Health Choice Illinois plan report card. Really showing directionality here. Progress was observed with the measure rates, even though in some cases we didn't see category score increases. So all of the green there, you can see the number of measures in each category that improved in 2023. The decreases were really in the doctor's communication category, which is a CAPS question. And so we'll be working with providers in our network to really address outliers and ensure that the information being delivered to our members at the point of service is really clear and easy for them to understand. 2/3 of measures that changed in star rating in this last year changed positively, which was really good to see. What you're looking at here are the low performing measures from 2022. So each year in our quality program, we develop interventions to really address areas of opportunity and then track the outcome of those interventions. What you're seeing here is the change in rate from 2022 to 2023, and you can see directionally with all of the green on there that we made significant improvement with those areas of opportunity from the prior year. Nearly 90% of low-performing measures from 2022 improved in 2023, and we're tracking to sustain that change in 2024 as well.
And just a quick comment, I think, as Emily's showing here, we saw really good incremental progress for us across most of our set of measures. I think as we've been evaluating the Illinois scorecard, one of the things that's also clear is the market itself has gotten more competitive on quality ratings. So our scores increased. Most of the other plans also have made some progress with our quality ratings. So the kind of relative comparison between plans held maybe a little more steady than we were expecting there. So it's also, I think, becoming just a more competitive marketplace in terms of quality performance, which isn't too surprising as we're heading into an RFP cycle with the state.
Yeah, I want to applaud you because you state that nearly 87% of low-performing measures increased, but the two outliers here, and can you speak to those and what we're attempting to do to get a positive ranking?
Absolutely. I'll start with childhood immunization status. We've done significant amount of analysis and determined that there are specific geographic areas that are lagging a little bit behind with immunizations for that population. We have education campaigns, specific outreach from provider groups, as well as care coordinators to try to close that gap. Additionally, we're partnering with some of the health departments to do education and immunization events in those communities. Some of our member rewards have also been adjusted to hopefully incentivize members to engage in that care. Pharmacotherapy for opioid use disorder is the other one. In 2024, our care coordination team really put a lot of infrastructure in place to flag members who are receiving new opioid use disorder treatment. And we're engaging them in care coordination to make sure that they're able to continue that treatment without any barriers. And that has been a successful intervention this year for us.
Thank you.
And yeah, just a comment on the childhood immunization status. The difference between combo 3, which you see increasing there, versus combo 10 is really the flu shot vaccination. And so that's where we've tried to target some of that outreach and engagement, as well as increase some of the rewards around the flu shot to try to target that measure specifically.
I believe it's going to take some work in that area. I saw a recent study this week that was published in terms of the expectation of how many individuals will get flu shots. There still is 1/3, 34-36% that do not plan to get a flu shot. So we just have to keep at it with the education and getting the information out there and taking every opportunity that we have to do that. It's tough to understand, but it's there.
We had a press conference with our elected a couple of weeks ago, but most of our commissioners, the president, we were all down in the cafeteria here, and we all got our shots on camera. Yeah. So yeah, we're trying to raise awareness. But.
Yeah, just wanted to recognize it's a tough piece there, but we just have to keep at it. Thank you.
Yes. And then we wanted to highlight in these last couple of slides some of the performance improvement strategy we have in place. We do have a specific action plan and strategies for each specific measure, but there are several strategies that really are overarching, impacting most measures, and I'll take a moment to highlight those now. County Care has dedicated resources to developing performance improvement work groups that meet regularly. It's a multidisciplinary team that develops an action plan, monitors progress, and then evaluates whether or not changes are needed to that action plan. The performance improvement work groups include multidisciplinary participants, so care coordinators, sometimes practitioners, and then a variety of health plan staff. Additionally, we regularly engage with providers and care management entities. They are a really important partner for us, and so in addition to hosting regular meetings with them where we can talk through collaborative effort, we also share quality, performance, and care gaps details so they can use that to really put forth real-time outreach effort to address care gaps. We have lots of things in play related to data improvement. County Care transitioned to a new HEDIS vendor in the month of July this year. And so in addition to transitioning all of our existing data sources to support quality reporting, we also are working to expand data sources available and have pursued some payer data exchange solutions to make sure that we're really capturing everything that's happening in our communities. Value-based care and incentives for providers is another overarching strategy. We have a large number of value-based care agreements, really prioritizing preventive services in those agreements, as well as sort of stretch goals to make sure partners are continuing to push their performance forward year over year. And then member engagement. There's a lot happening in multiple different areas to make sure we're educating, outreaching to members, and communicating in multiple modalities, recognizing members may need the message more than once in different methods. And so social media, print, communications, text messages are all used to ensure that members are getting the information they need. And then on this last slide, I'll highlight some of the things we've been working on this year to continue to progress with our quality performance. Related to preventative care, we started a partnership this year with Roseland Community Hospital and have hosted some mobile mammography events. More than 10 events have been held so far with federally qualified health centers in our network. Some of those events have been in partnership with redetermination events, so it really is a one-stop shop for members coming to those events. We continue to plan health fairs with Provident Hospital. The women's health fair is actually tomorrow, and the men's health fair took place in June. We hope to have a couple hundred women come out to the health fair event tomorrow, and that's a great alternative venue for women to receive lots of preventative services. We continue to work to implement scalable interventions to support low-risk members who may not be connected to a care coordinator and accessing care, making it easy for them. And we continue to work to focus interventions in those key geographic areas where we've historically seen disproportionate outcomes. For chronic conditions, we continue to work with our food care vendor to offer medically tailored meals for members with chronic conditions. We're working to expand disease programming, disease management programming with in-home services or other supportive services, and then continue to work on strategic outreach to those populations. Behavioral health, there are a lot of things in play. This is just a sample, but member reward increases have been one lever for us. We've worked to create some direct referral pathways, partnering with high volume facilities and key provider partners in our network. Additionally, we've worked to establish a strategy for high utilizer members, so those with multiple acute behavioral health events, making sure that we can holistically wrap around them and address their needs to ensure they're continuously linked to the treatment they need. Value-based care is another lever here. We're working with a value-based care partner specific in a behavioral health arrangement, really working to hold them accountable for timely follow-up. And then there's been a lot of expansion of behavioral health capacity in our network over the last 3 years. For maternal child health, we're working to determine how we can better identify members early in pregnancy to link them to care. We're evaluating healthcare access. We've done a maternal desert analysis, really looking at where there might be some access issues. We also have looked at perinatal outcomes by race, ethnicity, and region. Erin spoke to the community baby shower event. That was a really good engagement tool. And then we do have a request for proposal that just closed related to comprehensive maternal child health services as well.
This is to provide services?
It's to provide more care coordination, health coaching, education type services. It wouldn't be prenatal or postpartum care.
And when does it start? Because you said you just closed.
The RFP just closed. We'll be evaluating options, and I think the go live would be early in 2025.
Okay, thank you.
All right.
Thank you.
Any questions on quality before I move on? Great. And this was mostly a readout of our current quality scores, which we just got back over the past couple months, but that I think lays the groundwork as we look forward to 2025 around what a lot of our strategy will be. So as we head towards the January Managed Care Committee meeting, that roadmap and deeper dive on what some of the performance improvement initiatives will be one of the focus things that we bring back. Next, I want to provide an update on the Health Choice Illinois RFP. There's, I think, most of the information has been consistent since last time this committee met. We're still expecting the Health Choice Illinois RFP to be issued during the summer of 2025. HFS has started doing a number of what they call listening sessions with the community over the past several months to get feedback leading up to that RFP process. We're expecting that the new MCO contracts will start January 1st of 2027. So our current contract will run all the way through December of 2026. We at the plan level have already completed two drafts of a potential RFP response. Obviously, we don't have the exact RFP that the state's going to issue, but there's a lot of things that we have tried to anticipate based on past RFPs and by looking at what some of the other states have issued in their recent RFPs, and also knowing some of the current focus on strategic focus areas from the state. So I think that puts us in a good position, knowing that we'll have limited time once the RFP is actually issued by the state. But it's a lot easier to reorganize information and add detail than it is to build something completely new from scratch. So I think we're in a good position there.
I know in the past I've liked you that you're building the frame and the outside and everything there. Engine might take a little bit of transition, but when it's ready to go, you can drop the work that you guys have done on top of that and be ready to go. 18 months to do that, or whatever submission is.
Yep. Yep. All right. Next slide. I want to provide a few updates. Always want to show redetermination outcomes. This data is through July. We're still holding steady at about a 90% retention rate, which we're excited about. We're interested as we move forward and we see some of the volume decrease in just terms of the raw number of individuals going through redetermination. I think that'll give us some opportunities to try to continue to push this at that 90% or potentially higher than that 90% threshold. Just to put some context around that 90% number, pre-pandemic redetermination rates were in the range of 85 to 88% generally. So the 90% I think is a really good number for us in the sense that we're kind of beating the pre-pandemic redetermination retention that we have. One of the things that we've put in place over the past 18 months has been our community outreach and engagement team that's going out to do redetermination events. This just shows the number of events that we've had over the past 12 months, so closing in on almost 300 events, almost 11,000 individuals served through those events, and I think has been great, both in terms of the impact of connecting with members, but then leveraging that not just for redetermination, but also, we have the opportunity to engage with members at that point on whether they're, getting into PCP appointments. It also gives us a chance to really engage with various provider partners, to have events at their sites and just continue to build a number of new relationships. Next, I want to provide some updates on our provider network strategy. So we've got these core 5 or 6 areas that we have been focused on across telehealth, value-based agreements, network performance and analytics, provider engagement and network expansion, network technical improvements, which I'll focus a bit more on today, and then specialty care access initiatives. On the technical improvements, one of the things that we are excited about is that we've launched our new provider directory. This just went live over the past month. Bluntly, I think our previous provider directory left a lot to be desired just in terms of user functionality and kind of ease of use. As a member was going in to search for a provider, this provides a lot more ability to search by different topics, by languages that a provider speaks, by provider name, by location, and is just a lot more clear and user-friendly than our previous provider directory was. So we're obviously early. We're continuing to do a number of enhancements throughout the next 90 days to the tool based on feedback we get and continuous testing that we're continuing to do on this, but I think it's going to be a significant step forward for us, and we're hoping will also improve some of those user experience ratings that we talked about earlier that impact our NCQA and state of Illinois quality measures. On the telehealth side, this gives a breakdown of a number of new telehealth agreements that we've put in place over the past year. You can see that our focus really was on behavioral health, so we've added a lot of capacity in that space. We have a current RFP out as well that is focused more on on-demand virtual care as an option, but a lot of this focus right now has been on expanding the access to behavioral health, and then we're now being able to build some of this telehealth capacity into our behavioral health follow-up workflows that we have with our care coordination teams as people are coming out either of the ER or coming out of discharges from inpatient with a behavioral health diagnosis.
The selection of these providers, it was competitive?
Since these are provider agreements, they have to meet our standard provider agreement terms, but it's open to any provider that meets those standards is able to contract with us, similar to any other provider.
And you'll be evaluating these providers in terms of what they do?
Yes. So we'll have dashboards that we're going to be monitoring a lot of the impact that we see, and this as well as tracking some of the follow-up care and how much of the engagement we see with members, and obviously member experience we'll get feedback on as well. So as I mentioned, County Cares also has a current RFP out for telehealth services. This is looking more broadly at on-demand services, but then also testing the market for, in addition to behavioral health, other specialty care areas. So we know there's solutions that are out there that are around maternal child health, for example. So we'll be evaluating that as we get responses back from the RFP to see if there's other areas to potentially strategically try to address pain points for access, especially in the specialty space. But the other kind of main solution we're looking for is the potential to have more on-demand virtual care that could be used to divert what may otherwise be urgent care or potentially ER visits. Mm-hmm. And then last but certainly not least on telehealth, go one more slide, Deb, is the Express Care solution that Cook County Health offers on the provider side, as Cook County Health continues to build capacity within this, we're laying out a roadmap on how we partner around that. I think over time, this will grow to be a major integration point for us, and I think offers a lot of potential value that we can leverage. Again, kind of in that on-demand access space. So we right now are doing some smaller pilots, again, kind of trying to match with some of the capacity that we have under the Express Care tool today. So things like Cook County Health members that we're seeing with ER visits, we're sending some follow-up education and offering this tool out to them. And we'll continue then to expand that over time to broader and broader sets of our membership. And we'll continue to look at how we build this out as an option for our membership to use across our website and directory and some of those other areas.
How large is the list of urgent care conditions? Is it long list, short list?
I don't know that offhand. I don't know, Dr. Makaitis, if...
Yeah, I don't have a number, but it's all the things you would expect, right? The non-emergent things that people oftentimes would go to emergency room for, sore throat, like those types of, yeah.
All right, and then on the next slide.
I believe someone, Angela O'Banion, raised her hand.
Dr. Makaitis'
and she's remote.
Dr. Makaitis' answers is accurate. It's about 20 or so conditions.
Can you repeat that? We had the volume down too low. I apologize.
I was saying Dr. Makaitis' answer was accurate. It was about 20 or so conditions, the ones that you would commonly expect. We can provide an exact list if that's desired.
That would be helpful.
All right, next up is non-emergency medical transportation. We did recently go through a transition. If you want to move forward one more slide. This was effective in August, where we switched our NEMT vendors. Our new partner is Modivcare for non-emergency medical transportation. This provides some additional enhancements. NEMT services are generally a pain point, I think, for Medicaid health plans kind of across the market. But with a lot of the recent advent of on-demand transportation options, so Uber, Lyft, a lot of the technology advancements over the past decade, there's a lot of opportunity that we see to enhance the experience that our members have and help ease a lot of the pain points in getting to their appointments. So we're excited. Modivcare includes a mobile app that our members can order transportation on and also track where their ride is and when it'll be arriving, similar to our experience today with Uber or Lyft. There's also Lyft is an option for members as well. And then we have also looked to build some enhancements just on the overall network of how many transportation providers are available for our members as well to try to meet some of the demand. The next slide shows some of that impact already. So just in the month of August, we had almost 100,000 trips scheduled with our members. Generally, we saw good performance across call center measures. So we've seen this continue on now into September, into October with some tweaks along the way. But I think overall, we feel really good about what we've seen so far, and we're excited to start to see how this may impact some of the ongoing survey data we get back from our members about the services. I mentioned impact on networks, so we've increased the overall network size of transportation providers by about 140% compared to where we were previously, and this also gives us a great opportunity to continue to partner with a number of MBE, WBE transportation providers as well. All right.
How much that increase is? Was it significant or just?
It was about 140% overall across the network. On specific to the MBE, WBE, we'd have to pull those numbers, but there was a definite increase there as well. And then finally, I wanted to provide an update on the Illinois 1115 waiver. This is something we're very much looking forward to as this moves forward to get implemented. It provides us, I think, a lot of opportunities to expand on or leverage on some of the existing programming we have. The waiver covers a number of different social determinant areas, including things like housing, food, transportation, and so a lot of the things that we've already began building programming for and have in place for County Care today. But as this opens up some additional resources and makes this more systematized across the overall state infrastructure, I think will give us more opportunities to expand these services even more and enhance the way that we integrate these into some other areas of the plan. We're still definitely early in this process. We're waiting for a lot of guidance from the state around the 1115 waiver to understand exactly how the details of some of these programs will work, which we'll then be able to cross-reference with our current programs and workflows to understand the impact there. But one other area I definitely wanted to mention here is the justice-involved population. This includes an opportunity for us to do pre-release services definitively for our populations at CERMAC, but also potentially at other Department of Corrections facilities, which we have, again, built some of that already, but we found that there is a lot of value in being able to connect with individuals pre-release, especially with our care coordination teams, to help support them as they make that reentry back into the community. And if we're able to build that trust and connection before that release point, we're much more effective at being able to help engage with that individual as they're releasing back into the community.
What % of our population is justice involved?
There's not great data across the across kind of the standard membership information we get across the plan, but I believe that's between 10 and 20% of our health plan.
Aaron, I probably don't have all the information here now, and I'll get something to you. It's approached by Robert Wood Johnson Foundation has just recently released a major initiative under the title Justice Squared, and they will be looking for across the country provider organizations and systems to work with this initiative that they will be rolling out in 2025. And so it may be something, it's early now, that we may at least want to inquire about. Is there an opportunity, or does it align with our strategic purpose there? But it's a couple months away from being rolled out. But to begin to look for engagement partners at this point right now, and I looked at a preliminary list, I didn't see CCH on there, but that's because I don't think they impart. And so they did reach out to me to make some suggestions. So, I mean, that was an easy one. I said, well, I'll be happy to carry this forward. So I'll give you a call, send the information, and then whatever we may choose to do or not do with this particular. But it looks like a very credible piece in the area of justice involvement, specifically for the healthcare and healthcare systems.
Thank you. And with that, I believe that is my last slide, so I'm happy to answer any questions.
Questions? Okay, no questions yet. Thank you. Let's see. Action items. August 2nd, meeting minutes. They were approved by the board at the August meeting, but are being presented for the committee's review and discussion if necessary. Chair, are there any corrections that need to be made to the minutes? No corrections. I'd like to entertain a motion to accept the minutes of the Managed Care Committee meeting of August 2nd, 2024.
So moved.
Second. All in favor? Aye.
Aye.
Okay. Any opposed? The ayes have it. The motion carries. As the agenda is exhausted, I'd like to declare the meeting.
If I could, very quickly.
Yes.
Director Curry, I've understood that this is, your last Managed Care Committee meeting. On behalf of CCH, I just
Yes.
want to say thank you for your years of service on the board. I know we'll be celebrating you at the board meeting next week, but I just wanted to thank you for
Well,
your
I'd like
chairmanship.
to thank everyone and staff for putting up with me for these past 4 years. But no, it's been my privilege and honor and, to witness firsthand the great work, commitment, and service that each and every individual here in Cook County Health and my colleagues here as well have put in. It has made a wonderful difference. Thank you. And with that, I will adjourn the meeting. Thank you.